Good afternoon, Fiona. How are you?
Doing well. How are you, Stacy?
Awesome. Thank you for being here today. I just wanted to ask you a couple of questions about Interfaith Services Community, which is the organization you work for, and then a little bit of detail about how Interfaith and HomeAid San Diego work together. So, to get started, can you just tell me a little bit about yourself working with the organization and what's Interfaith all about?
Yeah, absolutely. So my name is Fiona King. I'm the Communications and Development Manager at Interfaith Community Services. And Interfaith we're the biggest human services agency in North County, San Diego, and we really are all about helping people help themselves. So we do that in a variety of ways through comprehensive wraparound services from food to housing to shelter to employment services, addiction treatment and recovery, and we really do it through the support of the community and partnerships like HomeAid San Diego.
Awesome. So when I hear interfaith, that rings a bell to me. Is it one group or are you several different groups connected together?
Right. So Interfaith is actually a nonprofit. We're a 501(c)(3), and our name is kind of in honor of our founding faith communities. So we were founded 40 years ago, and we're not a faith-based organization, but our faith communities came together and they started helping people through churches and mosques and synagogues. They were all helping, and they realized that they were duplicating their services and really not getting at the core of what needed to happen. And so then they partnered together and they formed Interfaith. And we started as just a little food pantry, and we've grown into a huge $18 million budget annually organization with 200 employees. And this last year, we helped over 20,000 people through all of our over 50 programs. And
That
so
is
so
amazing.
we do a lot around housing, a lot around ending and preventing homelessness, but we're really all about providing that wraparound services so that we can get at it's meeting people where they're at, right? Everyone has
Mhm.
their own unique individual story, and some people might need help applying for disability to get the disability income that they're entitled to, whereas somebody else really might just need help finding a job and with their resume. And so we really meet people where they're at, figure out what their needs are, and often it starts by people coming in for food, but then they meet with a case manager and we find out, okay, why do you need food? And then do you have housing? And it's all about that person-centered approach of meeting people where they're at and then going from there and figuring out how we can move them forward to ultimately reach their own self-reliance and self-sufficiency.
Well, that sounds amazing. I'm really glad that you guys have grown to what you are today. And, I do find that there's a lot of nonprofits here in San Diego that all are focused in on homelessness, on helping people meet their basic needs, food, clothing, education, health care, things like that. So, with that said, I work with a nonprofit, HomeAid San Diego, and what I've learned recently is that HomeAid has worked in the past with Interfaith. Do you have a little bit of detail about that partnership?
Yeah, absolutely. So I know HomeAid San Diego was really impactful in a project of ours called the Hawthorne Veteran and Family Resource Center. And that has turned into one of the most impactful programs that we operate. So that program, it's located here in Escondido, and the Hawthorne Veteran and Family Resource Center is where we operate our recuperative care program. And so this is for individuals that are exiting hospitals and they would
Mhm.
typically go back to the streets or have nowhere to live. And they really need a place to recover. And not only that, they don't have housing. So what's that program has turned out to be so successful because not only do people have a place to go to recover, we have licensed nurses there, but then we also have housing specialists that work with them to figure out where to move on from there, and then they can exit that program into their own housing.
Oh, that's great. How long has the Hawthorne Center been? How long has that been available? Is that like the last few years or?
Yeah, I think that it was in I know that it I think that it started in 2014.
Oh, okay.
Yeah.
Oh, no, that's
It's been
okay. I
around
just
for a
was
few
just trying
years.
to get
Yeah.
kind of a ballpark range because, like you
Yeah.
stated, the organization keeps growing and has all these different centers.
Yeah.
So
Yeah, it
specifically
actually
to,
opened in 2015. Sorry, I was
oh,
correct.
okay, thank you,
Yeah.
2015.
Yeah.
So
And
five
since then,
years, yeah.
yeah. And since then, 75% of the people that have entered the program have exited into their own housing, stable housing of their own, and recovered from whatever they were needing help from when they exited the hospital. So
Well, that's
it's a really
interesting.
successful
I
program.
didn't even think about that group that might have that need. And
Hmm.
we often see people who are living on the streets that appear to be homeless who do look like they might have a disability or might have an injury and things like that. So it's great to know that you guys have that up in North County. I'm
Yeah.
hoping that we have those in South County too, or Mid County.
Yeah, it's actually, yeah, it was the first of its kind in San Diego County, and it's still the only one. But we recently, actually just yesterday, purchased a hotel that a motel that we're actually the program at the Hawthorne Center that HomeAid helped make possible is so successful that, but the problem is it's always at capacity. So we've been wanting to expand that program, and so we purchased a motel in order to do that. So it's
And
really
so the
exciting.
motel will also be for that same group of people who are moving out of a hospital into
Yeah, it'll
extended
be for that
care.
recuperative care. And then it will also provide graduate housing for folks that just need a little bit more support. They have a housing plan, but they need a little bit more time to save money or what have you to move on to their next step. So it'll provide both of
So,
those things.
so graduate, when I heard you earlier mention it, I thought that maybe that was someone who was finishing up college. But when you say graduate, you mean someone who's actually been in a shelter and now they're in
Mhm.
like a semi-permanent housing place?
Yeah, that's pretty
Okay.
much exactly what it means. So it's a variety of reasons. So for example, one way that we're going to be utilizing the graduate housing immediately is we've been operating motels through the COVID funding. So when they moved folks that were in high risk categories into motels, we've been supporting that, and those are closing at the end of October. And a lot of these people have nowhere to go, and they've made so much progress, a lot of them too. And
Mm-hmm.
so we're going to be able to move those folks immediately into our new graduate housing at this new motel. But then on top of that, it's also for folks like from Haven House, our emergency shelter, which I know that HomeAid also supported in some construction there. I know that those folks, so they stay there for a few months, they get on their feet, and then they might just need a little bit more time to save some money up. And so this is a great solution, graduate housing, for those folks that just need a short-term stay until they can get their own permanent housing.
Well, I'm really excited to hear how everything goes with this new motel that you all just closed on because
Yeah.
I've been hearing about what's happening with the San Diego Convention Center and how that eventually needs to be handed back over, and how the city of San Diego is trying to purchase some hotels in the area to hopefully move those from a shelter into permanent housing, which would be amazing.
Absolutely. And
So,
yeah.
yeah. So the other thing I wanted to ask you about quickly was that I think you pointed out something about the pandemic and at capacities. What other challenges are you all facing that maybe those listening um, can help you all out with as you all kind of move ahead with helping people?
Yeah, so I mean, our work is really only possible, like I said in the beginning, it's only possible with the support we receive from the community and our partnerships. Without our donors, without our volunteers, without our partners like HomeAid San Diego, we also partner with a neighborhood healthcare, which we operate a full medical center at our headquarters, like you mentioned, folks that need some medical support. Without the community partnerships and the people, our work would not be possible. And so one of the biggest challenges that we faced in the beginning of COVID was a lot of our volunteers couldn't come in because a lot of them were in the high risk age groups and
Mhm.
categories. And luckily we had a lot of people step up, first time volunteers, younger folks back from college, step up to help us. We never shut our doors. We continued on, but it was just because of support we received from the community. And now what we're seeing is that this crisis is definitely not ending anytime soon.
Mm.
There has been a disproportionate impact on people that are hit hardest by these types of things that happen because they're already living paycheck to paycheck. And so we're really helping. At first, it was emergency response, right? Make sure we can feed people, rental assistance, make sure people stay housed if they can, get people off the streets if we can. And now we're moving more into the recovery phase. And so we've moved back to our case management model where we're working individually one-on-one with people. And a lot of times the people that come in through our services, their first meeting with actually a volunteer intake person. And so we utilize volunteers. So people interested in volunteering, we have great volunteer opportunities. We always need financial contributions as well. So those are two really big ways to get involved. And then we also, of course, rely heavily on in-kind donations. So donations of food. We had so many people donate masks in the beginning. We still need those, that kind of thing. So those are some great ways people can get involved.
Okay, well, that was amazing. I hope that everybody that hears this goes to Interfaith Services Community's website. You can find them online. And I've been there. It's very easy to navigate the site. You can do everything from donate to finding out their volunteer opportunities, and then learning more about what Fiona just mentioned, all the great services that they offer. So thank you, Fiona, for sharing this information with us. Is there anything else that you want to share with those listening today? This might be either someone just coming to HomeAid's site, or it could even be someone that's actually doing our Step Up Walk in November.
Yeah, absolutely. Well, so I think if you're listening to this and if you are participating in the walk, especially, there's been something that's engaged you in this work. You have some element of compassion and empathy for folks that are experiencing homelessness. And so first, I want to say thank you to that, because I think that it can be easy to overlook in our society. There's so much going on. And it's easy to just point that, oh, it's not my problem, or someone might think that they don't work hard enough or something like that. And after doing our podcast, we have a podcast called HomeAid in San Diego, Real People, Real Stories. At the end of each podcast, we have a action item, or what can you do? And every person that we've interviewed that has experienced homelessness, the most common theme through that podcast has been just treat people with respect. And so I think that if you're listening to this, you already know that people are people and we need to treat people with the human dignity. And I think that that's something that can be easily lost. And I think we really just need to be there for our fellow humans and realize that, I don't know about you guys, but I've been in tough times before, and I'm only where I'm at today because of people that have supported me in my life. It takes a community, and a lot of people come into Interfaith and coming to HomeAid San Diego is because they don't have those people. They don't have that community. So we're here to make sure that they do. And so that's, I think, the final note that I'll leave it on. And thank you so much for having me, Staci, and I look forward to seeing you at the walk.
Thank you, Fiona. Well, thanks everyone for listening. This is Staci Reidinger. I'm the board chair for HomeAid San Diego, and just a big advocate for us trying to figure out more housing solutions for the homeless, and just like Fiona mentioned, creating a network of wraparound services for them and getting as many of our San Diego County organizations working hand in hand, so that we're not duplicating efforts or doing something that takes away from the focus on the homeless. So thank you, Fiona. You have a wonderful day, and I'll talk to you soon.
Thank you so much, Staci.